After my post the other day on vitamin D, I had a friend ask me about how to increase her vitamin D absorption. So I wanted to talk about that for a second. Here's her situation. Um, she takes 5,000 IUs of vitamin D daily, which in my clinic, that's kind of a basic dose for an adult. She's outside quite a bit. She's very active. She's athletic, and she goes on a long hike at least once a week. And I think she said her blood levels generally don't get much above 29, or she's sitting right around 30. So her question was, what can she do to increase absorption of vitamin D? Well, the short answer is you can take your vitamin D with a fat-containing meal. Vitamin D is a fat-soluble vitamin. So the same kind of digestive mechanism that would help you digest the fats in your food will help you digest vitamin D and absorb it properly. However, I'm not sure that's going to make the difference that she wants it to make. 5,000 IU is a basic dose. A lot of patients need 10,000 IU a day, or maybe 10,000 one day, 5,000 the next, or we'll have them do 10,000 on weekdays, 5,000 on weekends, just some kind of blend. You just kind of have to keep doing a blood test to see where you are. Like if you went to 10,000 a day, did that for 60 days, maybe 90 days, and then ran another blood test, you could see how much it jumped. If you did 10,000 a day and all of a sudden you're at 75 or 80 in 3 months, well, maybe you do 10,000 every other day and see if you can get it to settle and not keep going up like that. You could keep increasing your dose until you got over 100 and then back off a little bit. That's another option. But consider we were designed to have significant skin exposure to the sun, like walking around in a bikini or shorts with no shirt kind of thing. And then the sun hits cholesterol and starts the first conversion of vitamin D on our skin. Then we have to absorb that into our skin. It circulates around. It has to get acted upon by the liver and the kidneys before it becomes active vitamin D. If we get exposed to the sun and then we wash our skin off before we absorb it, or if we get exposed to the sun and we don't have enough cholesterol because we're taking a cholesterol medication or our liver isn't healthy so it can't make enough cholesterol, those are all reasons why you may not be able to make enough vitamin D, or just lack of exposure. Like enough of your body is not exposed to the sun to generate that much vitamin D. Taking some of your vitamin D in what's called a triglyceride form, like the cod liver oil that I take from Standard Process, has naturally occurring vitamin A and D in it. So that's in what we would call a triglyceride form. And that's very easily absorbed. It's very easily used. So a little bit of that vitamin D behaves like quite a bit of the regular supplementation vitamin D. So adding a little bit of something like that can sometimes make a difference as well. If you really don't absorb your vitamin D well, like if you go up on your dose and your blood levels don't change, then I would switch to like a liquid vitamin D. They have drops of vitamin D where a whole dropper is 5,000 or a drop is 5,000. I've seen some where a drop is 2,500 units, so 2 drops would be 5,000. But maybe go for something liquid like that you can absorb through the mucous membranes of your mouth, and it doesn't really need to be digested as much. Those are all options to increase your vitamin D levels. But this particular person has a history of some autoimmune issues. So it's very important for her to get those vitamin D levels up into the normal range. For her, the optimal range would be somewhere between 70 and 100, really. But if she's sitting around 30, even getting above 55 can make a difference. So you know who you are, right? You know you asked me that question. So pick your strategy, do the work, double check, like do another blood test, find out if you're going in the right direction. And this is just a science experiment. If you want to increase your dose, give it a couple of months, do the test again. If you want to switch to a liquid, do it a couple of months, take the test again. If you want to find, I don't know, some vitamin D producing tanning bed and use that and then check your dose again or check your levels again. You just have to work through this until you figure out which action creates the right amount of vitamin D in your bloodstream. So do the homework, run the experiment, and let me know what you find out. Hopefully that helps you out.